Welcome to the Therapist Thrival Guide. My name is Miranda. I am a licensed clinical social worker here at LE. And today we are talking about some of the more administrative things when it comes to the therapeutic role. And honestly, something that I see and hear people ask about all the time. And so today we have some awesome experts, Jordan and Steve, to talk about billing and balances. So Jordan, do you want to go ahead and introduce yourself?
Sure. Hello, all. My name is Jordan Mealey, licensed professional counselor and clinic director for LE Mental Health of Central New Jersey locations, Flemington, Skillman, and Somerville, New Jersey. And I have been graciously appointed a clinic director within the LE family since last spring of 2023. So we're going on almost 2 years.
She was also one of our clinic directors of the year. She won the regional clinic director of the year of your area. So that was a really big deal.
One of the best accomplishments ever.
Just because I wasn't there.
You're lucky I like you.
I'm just playing with you. You know that.
Oh, it was so sweet.
Play.
So sweet to see Jordan weepy and just so well deserved. I love that. Aw.
It was wonderful.
Steve, do you want to go ahead and introduce yourself?
Sure. My name is Steve Drzewoszewski. I am a licensed clinical social worker, licensed clinical alcohol and drug counselor, CCS, a member of MINT, so Motivational Interviewing Network trainer. And I am one of the directors of LE Morris County. Morristown is my main office. We also have Parsippany and expanding to Basking Ridge very soon.
Awesome.
And we were also, I believe, not 100% sure, but I think we were the first LE in New Jersey.
Oh,
yes,
okay.
I think so.
Awesome. Awesome.
Yeah.
And Jordan and I go way back, so that's why we could tease each other. We worked at hospitals together and different things. So yeah.
I didn't realize that.
Yeah.
Well, so Jordan is not a newbie when it comes to podcasting with Ellie. She has been on several of our episodes all about grief and loss. And so I will link to those in the description because they're actually some of our most popular episodes. I think people have realized how helpful that information is. And Jordan killed it. She's such an expert in that. And so
thank you.
Yes, I will link to those in the description. But last time we were recording, gosh, I don't even know how we started talking about this. I think that, Jordan, you were saying something along the lines of, all right, I just had a really good conversation with Steve, or we just led a training for some of our clinics all about billing and balances. And somehow we started talking about oh my gosh, this is something that is so hard to talk about. It's something that is so crucial to talk about. And you both have figured out a way to talk about it really well. So I was like,
it's everybody's favorite topic, right?
Oh yeah.
Well, it's so tricky because I think that, insurance is hard, first off, hard to navigate. I am credentialed with a bunch of insurance companies and I still don't quite even understand how all of that works.
Totally agree.
To be honest.
Yep.
And you never will.
Right.
Because they keep changing it.
Sure. And so, and I think that when I first started at LE, I kind of had this thing where I was like, wait a minute, we don't have admin people, or I guess we have billing people, we have a bunch of administrative people, but you don't have a person that sits in the front desk. And so for a lot of the billing questions, clients bring those to you. And really, you're collecting copays at the time of service. You're doing a lot of the billing stuff, like the client to client or therapist to clients conversations. And so it was really intimidating to figure out how to navigate some of those conversations. And so I think this is going to be an episode that's applicable to anyone who's in the LE network, as well as therapists who are at group practices or in private practices that are having to have a lot of these billing conversations with clients because it can be tricky. So where should we start? Where do you all want to dive in? Are you just going to walk me through a PowerPoint? I'm just kidding.
I'm not going to lie. I have it shared screen right now to make sure that I go on the points that Steve and I made that were fun. Because we made we needed to make it fun, right? To an extent, at least. And also as kind of non-intimidating as possible. And at the same time, Steve and I are very loud, assertive people. So I think coming in and seeing it, that we're going to talk about financials, we just went with show me the money. And that's the name of our presentation to our therapists. And now I started even using it as part of my orientation days training of just going through the PowerPoint, even if it's one-to-one with a new therapist coming on their own. But just to be able to, like, the goal is to just be able to help our therapists gain comfortability to have financial discussions with their clients, learn helpful language, and know why is this so important to incorporate into your therapeutic model and relationship with your clients. Because many a times, and even me at the beginning, I was like, wait a minute, we're going to copays, get it. But the therapists are going to talk about balances. I'm like, oh, that's not in their wheelhouse. And at first I kind of pushed back more because I'm like, nope, this isn't in their wheelhouse. But then again, as like we started learning and I started learning and growing with Steve, I'm like, this needs to be a part of the relationship. This is important to be in the therapy conversation from intake, or even sometimes from the 48-hour phone call that we do to introduce ourselves before we even meet a person in person.
Yeah, I couldn't say it better myself, so I'm just not going to say it now. I'm just going to say something, of course.
Of course you are.
I'm powerless over my own mouth, so I just can't stop it anyway. It doesn't matter. It's so hard just to sit here. But yeah, I mean, it's not a comfortable conversation. Most people, when you go to school, when you go to social work school or counseling school or whatever modality you went to, they don't teach that. They don't teach business at all.
True. And it's needed.
Oh yeah, it's definitely, it's something that should be on the curriculum, because if you look at the statistics, most private practices fail. And why do they fail? Well, they fail because people don't go to business school. Therapists want to practice therapy. They don't want to do the other end of it. And they don't learn it in school. So they come in, they got to try to figure it out. Yeah. And it's not a comfortable thing. It's not fun. And we know that, so having that conversation, some of the fears that come up is, I'm going to upset the client.
Absolutely.
I'm going to, disturb my therapeutic relationship with the client, which is the biggest point. Like, we shouldn't be doing it because it should be somebody else.
Right. Don't we have a department or billary or someone else to do this for us?
Yeah, exactly. And that's the stuff that comes up, and it still comes up. It still comes up.
Yep.
On a regular basis. And, I think the thing is learning the skills. I mean, part of it, I always come back to, if you had your own practice, you would have to have these conversations.
Right.
You would still have to collect copays. You'd still have to look at balances and talk about balances with the client. What are the best practices on doing it? How do you do it in a way that's therapeutic, right?
Exactly.
Incorporate it into the therapy process. I mean, part of paying for services is taking that, I think, driving some accountability into the therapy, right?
Definitely.
It's, the client now is invested, right? So, you have to go into that stuff a little bit. And how do you make it part of that process? And that's a lot of what we talked about in the session is how do we incorporate this into a therapeutic relationship without disturbing the relationship? I mean, you could say a bunch of things. I could say things 15 different ways, and it could be the same thing and get a different reaction. So it's, how do you use the language? How do you do it in a way? And it may be different for different clients too, how you approach it. Yeah, go ahead.
Yeah, I just wanted to start off this conversation too by saying, like, the therapists that are listening to this, I think that sometimes we don't want to talk about money, or we don't want to have these conversations, exactly what you're saying, Steve, because we don't want to damage the therapeutic relationship. But I think that sometimes we also don't believe in, like, our worth as clinicians all the time. And so we like feel weird about, like, I remember I had a client a couple of years ago who straight up paid out of pocket for services. Like, I mean, just charged her credit card to every session. And I remember, like, charging that every week, being like, what? You're paying for this? Like, I mean,
you're paying me this much?
I know. And I think that was part of the thing that I had to start to get over a little bit of, like, you bet you're paying this much. Like, this is actually, like, this is a service. This is something I don't think twice about paying my kids out of pocket for, like, the primary care stuff, like there's stuff that you don't even think twice about. And so I think that when you relate it to that of, like, this is a medical service that's actually has a lot of value and people see the value in this, then it helps you feel a little bit more comfortable around some of these conversations too. But
absolutely.
I think, part of it is just creating, that sense of you're worth it.
Yes.
You know?
Your work is worth it.
Yeah. I mean, you went to school for how long?
And how much did it cost you?
Yeah. And I was going to say,
we asked that.
Do they ever give you a break on your college loans? Probably not. Right. You still got to pay that. So, I mean, I think, it's an investment. You made an investment in yourself. And I get it. Imposter syndrome is a real thing. We all have it sometimes. We all get into this space where it's like,
absolutely,
why is somebody paying me to do this? Right. Especially with my younger therapists. I mean, I really have it a lot with the younger therapists just coming in. It's their first, or maybe usually their second experience, because I don't like to bring people in that are just out of school, just because it's just not I think you really appreciate.
I think you need to be in the trenches for a little while first.
You need to get a little jaded, right? You need to
get in the trenches, get a little dirty.
Yeah.
Earn your merit.
Yeah. And then you come into this and you're like, oh, wow, my nervous system isn't on overload anymore.
Yeah.
And that's what most people experience. But I think, it's that whole getting past that, I don't feel like I'm worth it. And I think as long as you can focus on what you're doing with the client, right? As long as the therapy is what it's supposed to be, right?
Right.
I tell people all the time, don't be a paid friend. You have to have target goals. You have to have things that you're working on. I mean, it's good to have that, you build rapport. That's a big part of what we do, building a rapport with a client. But you can't just let it sit there. You have to move. You have to move the needle at some point. And when you do that, you don't feel as bad about saying, okay, you got something from this. There's worth here for you because we're actually going in a direction.
Yeah.
I think that does a lot for your confidence and ability to say, okay, we need to have the financial conversation. We need to talk about, let's go over patient aging with the, and go over that stuff and really stay on top of it.
To bounce off of that. So I kind of look at it and Steve had built, and I had built it into what I'll call the trifecta with the therapist too, is, getting ready and helping them, especially the young therapists who in the field of conditioning them for difficult discussions, right? Finances are not going to be, hopefully, the only or most prominent discussion that you're going to have when you're engaging and treating a client. So looking at it from one, how your work is worth it, and then two, conditioning them to be able to kind of formulate these corrective social experiences with their clients, to having conversations like this. And I'll say to the therapist, or I'll encourage them, if they're coming into us, right, with one, multiple, several challenges that are going on in their life, and if we are starting to notice, as hopefully we will, starting to notice some unhealthy patterns of behavior, some unclear or ineffective communication styles, those are the times where we're going to need to also condition to get a little bit get more comfortable with the uncomfortable, to say, hey, I'm noticing some counterproductive, behavior, this or that here and there. And that's a social experience to correct with them, to say, I'm pointing this out to you because I do care for you. And also because in order to make change, we do need to address these things, but in a non-judgmental and supportive space. So same thing with the financial discussions, hey, I noticed that it looks like insurance may not be paying as much as what we thought, or you're not only paying for your copay. There may be a deductible in there, which I feel like at this point, 9.5 out of 10 people don't know what their insurance plan is. I'm one of those people. I usually don't either because I don't get it. But to say that's not on me, and that's not real, and that's not pointing the finger at the client either. It's just saying, hey, we can call together, or I'm going to strongly suggest that you call your insurance services when you leave here today, because I think that there's a part of your plan that isn't covering this fully. And what does that look like? And how can I help you manage this to go forward together so we don't dig you into a deeper hole, not knowing what it is? So corrective social experience, helping the therapist condition for those discussions, and then just overall clinic success. I had a therapist recently who was struggling with having the conversations. And when they and I were one-to-one together about it, and not more or less avoiding collecting what we needed to get collected from the client because of that fear of what it was going to do to the relationship. I asked them, I said, well, if we aren't doing this in your situation, however, this other therapist or our other therapists on our team, our other team members are doing this, I said, are we also possibly putting up a moment where clients can be talking in the lobby and saying, oh, well, my therapist is so strict and they're collecting this and that. And then someone else saying, really? My therapist doesn't do that at all. And then we're kind of also opening up the clinic to some unhealthy splitting unintentionally, but just some unhealthy splitting and or even just saying like, oh, well, I'd rather go with your therapist because they're a lot easier with this and they're not going to bother me as much on the collections part. So it's also the clinic success and that teamwork of making sure that we're all aligned so that we know that we are communicating with each other and that the clients most especially know that our team is united and want to not only support ourselves, but also support our clients as equally as we can and as fairly as we can.
Yeah, I couldn't agree more. I mean, I think we all have to be on the same page. We all have to be working from the same playbook. We all have the same policies. We just have to follow them. And we can't say, okay, this one is going to do this. This one's going to do. So when you start doing that, then try and remember what the heck that is.
Oh, yeah.
2 months from now, right? 2 weeks from now, a week from now, whatever. But,
True.
And I think you have to kind of always go back to the policies, right? And some of the things I try to encourage, and I think we all do try to encourage, I know Jordan does as well, is have the conversations early.
Yes.
Have them early, because once they get built up, it becomes much harder because it's a much bigger number. And, try to figure out, see it from where, come at it from empathy, right? I understand, this may be difficult, but let's, try to work with the client. What can we do to help you try to get this taken care of, right? Because you don't want it to get to a point where the client has such a high balance, and I've seen this happen, that they stop coming.
Mm-hmm.
They just disappear. They go into the abyss, and nobody wants that. And it probably could be avoided if we have these conversations from the beginning, from intake, and let them know, just like we hear. I mean, anyone who's ever done a insurance, verification or anything knows that you hear a lot of classical music for a while. And then, then you hear the disclaimer, right? Verification of claim benefits does not guarantee claim payment, blah, blah, blah. I could repeat it probably verbatim. But we also need to have, look, this is the information we have right now. We encourage you to call your insurance company and make sure we're correct, because we may not be. And at the end of the day, also you go over that intake paperwork because nobody reads it. Nobody reads it. I've never met a client yet.
I was just going to say that.
Read the paperwork, right? So go over it with them. Bring it into your first session, right? I just want to go over this stuff with you. I know you signed it already, but I just want to make sure you understand and, go through it with them so they have a clear picture. Because I can't tell you how many times, like, I didn't know that. I didn't hear, And, granted, it's not on us to read it for them, but I think it also is, when you're handing somebody a ton of paperwork, they just want to get help. They just want to get help. They're just going to sign whatever. It's like when you go to the hospital, you're just going to sign whatever the heck they give you generally. Is it right? Maybe not, but it's what we're going to do because we just want to get the help we need at that time. And we're going to kind of go with it. So I think it's in the best interest of not having conflict and keeping that therapeutic relationship. The therapeutic relationship is only destroyed if we didn't do what we were supposed to do in the beginning. Right. I mean, it's like kind of like when you go back to MI, right? Who is responsible for resistance, right? Which is a word we don't even really use anymore. But resistance is the problem of the therapist, right? So is conflict, right? So if there's conflict with the client, it's our responsibility, right? We did or didn't do something. And we need to try to correct that. And I think a lot of correcting that is being proactive, not reactive.
Absolutely.
Think of the last time you were reacting to something. How did that work out? Probably not well. Reactions generally don't work well. You tend to overcorrect at that point and cause problems. So proactivity is the way to kind of alleviate a lot of this stuff. And like I said, going over what they signed, the policies, procedures, all that stuff, with the client early on, letting them know this is what we got. Now, this information, once we get our first, once we get our payment for, we get first EOB, we may get some different information here. So it's in your best interest that you also contact them to verify the information that we're giving you right now and let us know. The other thing is let us know if your insurance changes. That's another one that happens all the time.
Yes. Yes.
We actually put it on our in the lobby. We have it in our lobby, like, please let us know if anything changes, because that's another one that can cause a lot of problems. We don't find out for a month.
I think I got that from you, Steve, because on our receptionist app, when they come in, it says, "We're so happy to see your face. Please tell the therapist if your insurance changed."
Yep. We did that a while back because we kept running into that. So it was one of those things where we're like, and you got to be able to move with what's happening, right? So you can't anticipate everything when you're building a practice. This is one thing I'll say to any clinic director who's starting or you will not be able to anticipate everything. But listen to some of the people that have been doing it for a while. Get as much from them as you can. And then, hopefully, you don't make a whole lot of mistakes as you go, because you're going to make them. We've all made them. And, just try to figure out how you could limit that a little bit. But like I said, this is a big, big issue. It's a big conversation. It's really hard to have. It's hard for me to have it with my staff members. So I can imagine sometimes it's hard for them to have it with their clients. So, because you're going to get pushback in a lot of ways.
So what I'm hearing you say is, like, sometimes that first intake appointment, or if it's like a transfer client, still kind of like that first initial appointment with your client is a great time to just relook at some of that documentation. Say, okay, I just want to make sure that you're aware of some of the financial policies. Maybe this is something we'll get into later, but like cancellation policies, no-show policies, all of that sort of stuff, making sure that you're talking through that at that initial appointment.
Yes.
And then just because that really does prime the client. I mean, a lot of clients, like, you're their first therapist. They don't know what therapy is going to look like. And so if you bring up some of that stuff, then great, that's fine. I mean, I think that they don't really know that wouldn't be common, or you know what I mean? Like, I think that they are going to follow your lead. And if you are confident in wanting to say, okay, we're going to talk about this, so that, if you have any questions, you can always bring them to me. And even just being, one of the things that you had said too was, not being afraid to even call their insurance with them or referring them back to their insurance. Yeah. I think that it's really important, like really in those first few months that you're seeing a client, to make sure that you're looking at their statements regularly. Make sure, because I have found that some of the times where I have the hardest times I find that the hardest times that I've had when it comes to this topic is maybe a client that I have just started seeing. They didn't understand their insurance information. It started billing. And then you know how insurance works. It takes 30 to 90, whatever days to get it.
A while.
Yeah. Right. And so then it's not until you've seen them for a while that you're like, oh, shoot, this is an issue. We didn't realize this. And so again, being proactive, having those conversations ahead of time so that it doesn't make that first conversation really hard.
Exactly. Huge proponent of that. I mean, I've worked in schools in the past and transparency, we're going to be honest here. We're
being honest.
Right? My experience has been that we, in schools, at least in the area that I have experienced in New Jersey, still much more reactive with interventions needed instead of proactive and preventative, of what to set up beforehand, what to educate beforehand, what to prepare ahead of time prior to shit hitting the fan.
I mean, basically. Jordan, our whole medical system is reactive, not proactive. And so it's understandable that this is.
Exactly. So the more the merrier in something like this. So we will do 48-hour calls, which I'll train the therapist on, bringing up some of these particular policies to be able to review and ask questions on. You get them or you don't get them on the 48-hour call. We also follow up with an intro email. that then we bulleted some general things about, especially insurance, for the client to be able to see ahead of time as well. So then coming in, just like Steve said, I think it is super important to go through some of the meat and potatoes in the beginning. And as you said, Miranda, late cancel, no-show policy for sure is one of our biggest ones. Just to review and reiterate, if you have not spoken to your insurance company, I would absolutely do that after the intake today, just so that you hear it from the horse's mouth. That's what I tell them. I'm like, we have a verifications team that works really hard with us to be able to get as accurate of the information about your plan as we can. However, I'd still really, really encourage you, call and hear it directly from the horse's mouth for yourself. And they're like, oh, okay. And, hopefully most of the time that happens. But again, I will be transparent with people too and say the turnaround time is no less than, let's say, 2 weeks, but I usually 30 to 45 days for us to get back information from your insurance. So in that point, if I'm seeing someone weekly, that's 4, 5, 6 sessions at however much we're charging per session that's going to insurance. That, that could be easily over $1,000 on somebody if something isn't covered that they think was going to be covered. So super, super important to be able to have this proactively and ahead of time for sure.
Yeah, and high deductible plans are our biggest, like I said, you get these and you don't realize, sometimes until there are a few sessions in, and then all of a sudden you're paying for your entire session.
Exactly. Exactly. Yeah.
And that becomes a difficult conversation sometimes if you don't do the prep work. You got to do the prep work.
Yeah.
So how would you go into some of those difficult conversations, say that happens? Because that does happen to a lot of people.
You want to go first, Steve?
I could. I mean, I think
age before beauty. Go ahead.
Oh, ow, that hurt. That hurt. Oh my God. I am getting old. I can't see anymore. It's like, oh my God, let's go. So every day you wake up, you're like, oh, that's a different pain. Damn. Where did that come from? All right. So that's something new. But no, I think going into those conversations is difficult. It's not hard. I mean, it's not easy. You're gonna have, and if you did the prep work, like I said, if you did the work before, you went over this with them, hopefully they called their insurance, so maybe they're not too surprised that this is going to come up. But
let me pause you right there really quick, Steve.
Sure.
So just hold that thought.
Pause?
Yeah, exactly. I think that even if you are not someone who did that prep work initially, I think here's a tip for you. We are getting close to like open enrollment season. We're getting close to like the end of the year by the time this season or this episode airs. I think that if you are a therapist listening to this and you're like, oh shoot, I didn't do this. This is a good time to say, hey, it's the end of the year. Let's relook at some of these financial policies.
Yes.
Let's talk about what's coming, your upcoming insurance policies. Like, I mean, point. if you're like, I think that it's an easier time to be like, hey, we haven't discussed this, but open enrollment is coming. Let's make sure that like you understand how this works. And then also you can keep that in mind for insurance policies that you're going to be shopping for. And then if you're listening to this in 2025, January has already rolled around, then you say, hey, it's a new year. You just signed some new consent documents. Let's talk. If you're a clinic that does it annually in January like mine does, then you could say, hey, you just signed some new consents. Let's just take a minute and use this as an opportunity to just like make sure that we're on the same page and that you understand what you signed. And I think that going off of one of your other points, Steve, where it's like always thinking about when insurance is changing. I mean, thinking about that new year, let's have a conversation with every one of your clients. Make sure that their insurance hasn't changed. Make sure that they understand what their benefits are. Let's just make it normal. And so,
so
great. Unpause.
Okay,
Agreed.
I'm back. Usually when you pause somebody, you have some weird look on their face or something. You ever see that? But this is just my face, so it's all good. So yeah, I mean, a lot of great points. I look at it like this, right? I think every therapist should do an end of year review with their client. Just like you do performance appraisals at work, right? So why not take a look? Let's take a look, like we're coming to the end of the year. Let's take a look at all the things we've accomplished. Let's take a look at all the things that, where we're going. What are our plans? Reestablish some new goals for the new year, because you're starting at a clean slate right there, right? So reestablish, even if someone's only been with you for a month, let's say, okay, so we've been a month. It's coming up on the new year. What do we want to do in 2025? But also incorporate that piece, right? That piece is really important, and we don't think about it. Most people, unfortunately, don't think about it until it hits us, right? Until we become reactive. Is usually around February or March, you're getting hit with these clients who have these high deductible plans now, or switched insurance and didn't tell you, and then you're suffering, because now you're trying to backpedal, trying to go backwards. If you start this in November, December, and start working up to it, any changes, I would ask that question to every client right now. Do you anticipate you're in open enrollment probably right now, or coming up on it, right?
Mm-hmm.
Do you anticipate any changes? Is your plan a high deductible plan? Do you know? If it is, what do we plan to do in the new year? These are all good conversations to have, and you shouldn't shy away from them. I think you get to them early, you don't have to worry about them.
Mm-hmm.
If you get to them late, you're backpedaling, and you're going to feel bad, and you're going to feel like, oh, now they owe us $1,000, and how do I even approach this with them? I know they don't have any money. It's a whole thing, and once again, it's that balance between your service is worth something, right?
Yeah.
I mean, a therapist got to eat too. And I say this to my therapist all the time: you matter as well, right?
Yes.
So don't give too much of yourself to the point where there's nothing left.
Mm-hmm.
You matter as well. You have to have that balance. You got to take care of yourself first, like when you're on a plane, right? You put on someone else's, you put on your mask before you put on someone else's. Well, you have to do that in the helping professions as well. And I think, take care of yourself, and then you can take care of your client. But make sure you're having these conversations early. It will save you in the long run.
Yeah. And
so going into like the hard conversations then.
Yeah, like, with our therapist or with the clients?
No, like if you're a therapist that you're like, oh my gosh, I'm thinking of this client that has a $800 balance or something. Like what advice would you have for bringing that conversation up or kind of starting that conversation if they haven't really been proactive?
Sure.
Or maybe even if they have.
Yeah. I'm a big supporter and believer of teamwork makes the dream work. So, for example, for my clinics, at least for one of them that's gone 1 year fully around the sun at this point, that, what's worked well for us so far, what has not worked, what can be better from last year so that we can improve a little bit more this year. So I encourage my therapists, and thankfully I have two fantastic clinic managers at two of my sites, that also love math and numbers, which I don't do math. So I'm really also
understand that.
I'm very lucky. Yeah, they love math and numbers. I don't get it either, but you know what? I love them, and I'm going to keep them around for a very long time. So we'll talk with the other therapists, and we'll coach them and say, here, let's meet, let's prepare ahead of time for those clients or client, so that I can make sure, or they can make sure that you just feel as supported as possible, and that you're going to be able to feel confident and comfortable with the language you're using when you talk to them. I mean, and sometimes it's just making sure that the therapists know what our financial policy is, and what the financial responsibilities are to the client, and what the client possibly read in their intake paperwork and signed for from the beginning at two. So what is the clinic's policy on payment plans? What is the clinic's policy on, if you have balance up, like at this particular mark, are you pausing services to help the client work that balance down so that, again, they don't dig a deeper hole for themselves? And it's a lot better and easier of a conversation to say, hey, it looks like you owe us $75 because of this, that, or the other thing, instead of, ooh, I waited because I was nervous and now they owe us $380. Very different. I would be more than happy to listen as to why I owe someone $75 than them telling me I owe them $380. So just helping clear things out so that the therapists feel like they're also in the know before they go into those conversations. And I know for myself and for the 2 clinic managers that I have, we are more than willing to and say, hey, even if it's for your first 1, 2, 3 times that you're going to do this with a client, if you tell me ahead of time, I'll do my best and plan to be there with you. So that if it's helpful for me to kind of model and show you how and what I say, because some people just learn better that way. I'm definitely a visual learner. Then I'm more than happy to do that with you. And many times the therapists are very grateful to be able to at least have that option.
Yeah, I agree. And it is, once things get out of hand, it is a hard conversation. So like I said, we reinforce this about 100 times. And I know your question is, what do you do when you have to have the hard conversation? And I think Jordan answered it perfectly with, basically, I think the therapist has to also feel supported. It's really important. I don't think anybody should ever be, well, you got to have the conversation and you're on your own. Especially if they've never done it before. If you do that as a director, shame on you. I think, I ask many times, probably many times a week, what do you need? What can I do? How can I help? These are all questions that should be asked frequently. Now, like I said, there's sometimes you got to say, okay, you got to kind of look at, okay, is this going to be good for you to do on your own at this point? Right? Because sometimes that happens too. You got to kind of get people to that space where they can feel confident in themselves, right? But I think you gotta really be in tune with the way people are working and how they're moving in your clinic, and the level of the level of confidence that they have at that moment. And I think Jordan and I are pretty fortunate to have a lot of really great people that work at our clinics. They all seem to, I think you have 2 types. Some that are like, I don't want to have the conversation. The other one's like, oh, I'm having that conversation today.
I'm getting paid. I'm getting paid.
I think you brought up a really good point though, where like you might be more nervous to have this conversation if you don't understand what all of this document, like what all the paperwork says yourself. And so like maybe that very first step is just getting really clear. Well, of course you should have already had that, whatever. But getting really clear on this is what our financial documents say. And then even just if you see a balance, trying to understand yourself, where is this balance coming from? Maybe it's reaching out to your biller person and being like, are these copays are the copays higher? Is this a high deductible plan? Can you help me understand where this is coming from? Or talking to your clinic director, whoever, and trying to get an idea of exactly where this is. And so then you can say more confidently to your client, these are the policies and this is where these charges are coming from. And then even like, do we need to change the amount that we're charging each week? Do we need to talk about a payment plan? Do we need to pause services for a little while so you can get caught up? All of those are really good points. And I'll say too, like when I have a hard conversation, whether it be this type of conversation or a different type of conversation with a client, I'll do it right away at the beginning of my session. And I'll say, hey, before we jump into things, a couple housekeeping items, saw your statement. I noticed that you have a balance. And so, I talked with our biller person, or I tried to figure this out a little bit, and here's what I'm learning. And I think that even just knocking it out right away is going to be helpful, so that then you can say, let's take care of this. Do you have a credit card I can put this on now? Wanted to get this out of the way so that we can just focus on the session. And then, you can let me know next week. Or you know what I mean? Like just kind of giving them some of the reins too.
And I think that's a topic that can possibly uncover something else that's going on. Or of course, finances are one of people's biggest stressors. Then you do it early on in the beginning of the session. One, you're out. It's out. Let's process it. But maybe it uncovers something else that they're like, well, this is because of this. And then we start going through it, and we have a full session to be able to do it. So absolutely, I totally agree with that.
Yeah, I agree with that as well. And the other thing I just want to capstone on this as well is, one of the things we try to do, and we certainly ask all our therapists to do, is collect the copay at the time of session.
Mm-hmm. Absolutely.
Mm-hmm.
Before you even bring the client back into your room.
Mm-hmm.
Yeah, I mean, you could start off each session with that process, which takes you right into it.
Absolutely.
Right? You get right into it. It's kind of like an open door right in. You can say, oh, here's what else I noticed. What can we do here? Can we, maybe I could take an extra 10 till you get caught up or whatever.
Yeah.
There's a way to navigate that. But I think if you start with that and that becomes the norm, right? Every time I come in, I have this conversation.
Yeah.
Well, it's not going to be awkward anymore.
Right.
Yeah.
Right.
Yep.
Well, and like at the end of, I love doing like concurrent documentation where like at the end of my session, it's normal. I pull out my laptop and I say, hey, I'm just going to like take our note down, like let's talk about scheduling. Does this work?
Mm-hmm.
So I usually do more of that at the end of my session or like take copays at that point. But if there is an issue, I could see how like, that should be something we talk about right away.
If you do it, I mean, like I said, everyone's going to have their own style. My preference is always do it right up front, get it in the mix, because if there are complications, now you have time.
Right.
Because a lot of us have a client right after the next client and then right after that. And it's really hard. Once you get backed up, all of us probably know this as therapists. Once you get backed up, it is really hard to recover.
Yes, it is. Yes, it is. Yes. And on that note, we're like coming up on time.
Yeah.
Any other?
We're getting kicked out.
No. Any other last thoughts or tips that you would have for therapists that are kind of approaching some of these conversations?
I'll just be one of those corny therapists and say that, whatever you are having hesitancies or, feeling nervous about talking about or asking about with clients, just know that likely there's at least one person next door in your office that has gone through it already or is feeling the same way. Lean on each other. We need each other. We're our people. So lean on each other, talk about it, ask the questions, especially if you have your team meetings, because there's probably more than just you that has those questions. And it's just so important for our growth together to be able to just be honest and bring those things out so that we can support each other.
Yeah, and I'll just cap that, saying this pretty much the same thing. Lean on each other. Use the people with experience that, are in your office. Because, I know every office is probably a little bit of a mixed bag. You have people that have been doing it for a while and you have people that have been doing it for, a week, right? So, I think, everybody, the newer people, please, ask the questions, rely on the people that have the experience around you, or even just your teammates, any of them. And then the people with experience, please, share it with everybody else. Because, as clinic directors, we cannot be around all the time. And we're always available by phone, but we're also doing stuff too. So, you have to lean on each other and then lean on us as much as we can be there for you too. So, and we really try. Yeah. So
I was just going to say too, if you're working with kids, I think sometimes this can be hard because you're not talking to parents in every session. And so for me, when I've worked with kids, I try to make it a habit of checking in with parents either by email or like at the first 10 minutes or the last 10 minutes of session every month. And I know that might sound like a lot. For some therapists, they are every week. But I think just getting into practice of checking in with parents and, asking them, hey, any updates, any changes, wanted to check in and see how things are going on your end. I think that's always a really good practice too.
And that's really great advice because it's something we didn't really think about this time around. Is that sometimes the payer isn't the client.
That's true. That's true. Absolutely.
I feel like the times I've gotten in trouble where like my clients have big balances is actually when it's happened with kids because I'm not checking in with them as much or
true. Or, not every time. Yeah.
But
and you're not going, hey, little Johnny, why aren't you paying your bill?
I know.
Tell your mom to pay us.
Tell your mom to give us money.
Yeah, nope. That's usually the problem.
That's frowned upon.
Yes. Mm-hmm. But I think it's a good practice, like all three of us have mentioned at some point today, is just looking at it ahead of time. Take that extra 20, 30 seconds even just to look at balances, remember what copay you have to take before you even bring them back to the office, or when a parent maybe or guardian is dropping somebody off so that you can talk to them. I know I liked that at conference, Erin Pesh mentioned it, that she does all of her housekeeping in the first 10 minutes. And I'm like, see, it's okay. Like, I think it helped normalize it for some of the therapists or clinic directors that were in the room with her of, look, we all do that. And yeah, I mean, you think that it takes up some of their time, but this is part of their treatment. Has to be these conversations.
Yeah.
Yep.
It's part of the therapeutic relationship. And if you normalize it that way, it's not as hard.
Right. Well, awesome. Thank you both so much for joining and talking through some tips and ideas. And maybe if you're a therapist listening, you got some good ideas. And also maybe this serves as a good reminder to go check your client statements and make sure that everything looks good.
Every third week of the month, those statements come out on the documents tab.
There you go. I think, good reminders. Awesome. Thank you both so much for joining.
Thank you.
Thanks,
Have
Miranda.
a great rest of your week. Thanks for listening.